Thank you all for joining us on our first panel of the afternoon today, day 2. We have 3 panels lined up here with great experts in providing insight in different topics. So from what we heard from Kevin this morning, we all feel the pain of sitting at doctor's office and just waiting and waiting and waiting, and somebody opens the doors like me. You know, like, nope, next person, right? So you still keep waiting, and you don't really know when your turn is going to come, right? And the other thing I personally dread is going to a doctor's office, different doctors, filling out the same paperwork over and over again, providing the same information about my health and background and what diseases I may or may not have, if I have asthma or not, and same thing all over again. And I used to kind of cross all of those options together, and then lately I was told that actually you have to check one by one. So painful, painful. But just imagine if there is this immutable secure database, maybe called blockchain, where I put all my information in that database and I grant access to anybody I want and the type of data I want to give them access to and when and where, right? And I don't have to do that again. So with that, we have a great panel of experts here that we're going to dig deeper into that conversation. Basically, we're going to start reimagining what healthcare is going to look like or can look like in the future. So let's start with our panelists by welcoming them to the stage. So we'll start with Chuck. Yes, come on, Chuck Paseda, Chief Information Officer with Renown Health. Please. Come on, Chuck. And then we have Rick Hopfer, SVP, Chief Information Officer with HMSA. Please welcome Rick. And Kyle I'm sorry, I'm going to butcher it. Seiter. Thank you, Kyle. Chief Information Officer with
Elara Caring.
Thank you. I love those panelists. Thank you so much. And last but not least, Nishant Verma, our moderator and partner with Avasant. Thank you.
Thank you, Sharon.
Of course, yes.
Thanks a lot, Sharon. Thank you, everyone, for being here. Really honored to be hosting a panel of 3 very esteemed CIOs. I've had the pleasure of knowing them and working with them for a long time. So as Sharon was kind of talking about, right, this is to do with patient centricity, patient experience. How can we make healthcare more consumer driven? And how does it connect with health outcomes, right? Value-based care. Now, before we kind of get into all the cool stuff that Elara Caring, Renown Health, and HMSA is doing, we should take a step back maybe and just think about why we are even having this conversation about healthcare today. We don't talk about this for banking, for example, or retail, because we've gotten used to that experience, and that experience is kind of the default experience for us. And in healthcare, maybe the forcing function of a market-based choice is not available, and that's kind of led to some impediments to kind of rolling out a consumer-based or consumer-centric healthcare system. But things are improving. I mean, yes, Sharon, we do have to fill up that clipboard full of information, but I've had instances where I can now check in on an iPad. Sometimes, doing a telehealth visit, you don't have to check in at all because they have their information, your information. So things are changing, but yes, it is inconsistent. It's not the same as, my bank on my phone as yet. So to kind of get us started, the first question I want to kind of throw open to this panel is, when it comes to patient-centric healthcare, from a patient perspective, it's kind of, it means better health outcomes, right? We are talking about a lower cost, more choice, a better experience when we visit a healthcare facility or we interact with our payer. But from a healthcare provider or a payer perspective, how do you kind of think about your success, or what are the things that you are trying to achieve to get to a patient-centric healthcare system? I'll maybe start with Chuck, because Chuck, you cover both the payer and the provider side. So what are the top 3 objectives that Renown has from patient centricity perspective?
Yeah, thanks, Nishant. So welcome, everybody, by the way. Thanks for taking time for this session. It's interesting what's happening today from a patient centricity standpoint because of COVID. We started out with the televisits, right? And that was very successful. That was the only way you could see your provider. My organization, we have both the payer and the provider. And the interesting thing about that is we're becoming kind of close friends with the payer side because we are now in a situation where we're both going in the same direction regarding patient experience. Typically, these type of panels, my buddy Rick would be down the end because we would hate each other, right? Because we're not sharing information or any of that kind of stuff. And but he's sitting next to me now, so that's a start, right? That's a start. But what COVID has done is really kicked open the digital front door, and it's also really pushed forward value-based care versus fee-for-service, right? So fee-for-service, if you remember, that's transactional. We're starting to move away from that. I heard an expert say one time, if you stay on fee-for-service, the best thing a hospital could do is open up a store and sell cigarettes, right? Because that's how we get paid. More cancer, more dollars, right? Completely opposite now. So with what we found out through COVID with televisits, that people love that digital experience, right? And a lot of you, I'm sure, have been part of that, and it's not going away. So now we're trying to figure out how can we take the patient on a digital journey throughout the whole healthcare enterprise through their continuum of care and keep them on that digital journey as far as we can go, all the way to the home, right? And so what's happening at Renown right now, we actually have a pilot, hospital home pilot. We have something called a bio button that sticks on the patient, and we can monitor them 24/7. We have a big regional transfer operations center with nurses sitting in front, looking at 24/7 streaming data, coming off of 9 modalities, including sitting down, standing up, walking, lying down, EKG, a variety of vital signs as well. We're also doing that in the inpatient setting as well. So we're trying to figure out, and by the way, we've talked about this earlier, is that there's no cookbook for this stuff, right? Everything else, implementing EHRs, all that kind of stuff, everybody's done it. We're all trying to figure this out. So you're going to hear all different opinions today as to the best approach to do this. But the key is keeping that patient on the digital journey as much as you can, from the beginning front door to the back door to home, as much as possible. And we're looking at all kinds of different technologies right now to make that happen. But to me, that's the key to success going forward in healthcare.
Thank you, Chuck. And the digital journey that you talked about, it typically, for a patient, it starts with the payer interaction, right? So if I have a condition, I first go to my payer portal, figure out which doctor I need to get to, and try to set up an appointment or use that channel. So Rick, from your perspective, as you think about the future of patient centricity and where we need to be, what are the biggest leaps that we need to take? What are those areas? Where are we kind of a little behind or working towards?
So first off, a couple of questions for you guys. So how many of you are in healthcare? So a majority. How many of you are on the payer side? Okay, provider side? And somewhere in the middle. So if you didn't raise your hand, you're doing something else there. In some sense, we're all in healthcare because we all go to doctors and we all have insurance. So Kevin's, I usually fly around at about 100,000 feet, but when Kevin did his thing, he's like at 1,000,000 feet. And it's kind of scary when he's talking about all those things, and I'm thinking about how am I going to implement at 20,000 feet? Because where we're at today versus where do we need to get to, we have a long way to go. So and for starters, HMSA stands for Hawaii Medical Services Association. In Hawaii, nobody knows what Blue Cross Blue Shield is. Here, it's Blue Cross Blue Shield Hawaii. So being part of the Blues system, and in Hawaii, we have a little over 65% of the market today are members. And most of that is commercial. A lot of them are now aging into Medicare, Medicaid, so there's a shift there. But HMSA itself is a very trusted brand. And for the last few years, we've been resting on our laurels a bit, right? Because we're not, as a company, trying to go get more market share. It's between us, frankly, and Kaiser. Kaiser is more of that closed system, similar to what you guys are setting up. We're really part of the open system where you can pick your own doctor. But for the last few years, with the cost of healthcare continuing to rise, and today I think it's almost 20% of GDP. If you think back to, I think 1960 it was 5%. In 2010 it was 13%, now over 20%. So all of us are experiencing this huge increase in cost. So company goals we have are how do we reduce the cost of healthcare and improve the quality at the same time. The patient experience is changing a lot also. So even what you mentioned about a patient portal, we would have a hard time today, one of our members actually going on and scheduling an appointment, right? We need to integrate more. So when we talk about integration, and since most of you are in healthcare, data is still critical, and how we share data so that we don't have to go into the doctor's office and continually fill out the same forms over and over. But that sharing of data is still technically it's getting easier. The standards are making it get easier. Getting data sharing agreements are usually where it gets stuck, and then trying to figure out where is the value for the provider, where is the value for the payer, and then how do we share that information to create the best experience we can for our members. So we are looking at what will the impact, and technology is absolutely going to have a big impact. So we all know that. I don't think we're going to be the George Jetsons, as soon as maybe Kevin was predicting. I may be wrong, but there are still a lot of things that technology will enable to make the experience better. And it's not always the technical challenges. There's also the legal and the privacy and the security and all of the other things that sort of get in the way. But from a HMSA perspective, very much our roadmap is looking at how do we provide the best experience, how do we lower the cost of care, how do we become a better integrated health system without being like a Kaiser, how do we create the relationships with our health systems. And personally, if many of you probably have Epic, and so you can go on from your provider side, you can see a lot of that data today. And frankly, I like to be able to do that. What we're not doing enough, though, is sharing. So between providers, we're not sharing yet. Ideally, you want to go one place and see all your information. And ideally, at some point, go one place and do a little bit of shopping, but we'll talk a little bit about more of that after.
Thank you, Rick. Kyle, as we talk about patient centricity and experience, right, the segment of market you are in, which is home health, that's where the patient experience is more intense and enduring because you have patients under constant surveillance and care. In your world, what does the future state of a completely patient-centric, outcomes-driven model look like? If you can share that vision, and how far do you think we are from there right now?
It's a great topic and a big challenge in the home health industry because technology has been limited based on regulation, and we operate typically with CMS, which is Center for Medicare and Medicaid. So those are your most vulnerable patients, typically your geriatric. And as home health expands, it's really opening up to really just anybody that wants to be cared for at home. So our challenges in this space are how do we get reimbursed effectively for the care that we provide, and how do we profit, obviously, off of the care that we provide that is good for our investors, our shareholders, and so forth. So Medicare and Medicaid, as an example, do not offer reimbursement for telehealth. So as we shift towards value-based care, it opens us up to opportunities to partner with providers and payers under a capitated or a risk-based model. And those models allow us to remove the constraints that CMS imposes on us for reimbursement and allows us to provide a better course of care to the patient with the goal of returning them to a healthy state faster than what they would have been previously. So how far do I think we're away from that? It's happening now. Our company is one of the first home health companies to enter into value-based agreements. We've got 2 joint ventures that are going on, and a number of our competitors are moving towards, through forced means of CMS, through what's called VBS, or value-based purchasing, or VBP, value-based purchasing. And as that transition happens, the focus is really going to be on quality of care and not the reimbursement associated to it. So it's a really exciting time for us to be in the industry right now.
Fantastic. And if I can extend that question a little bit, Kyle, you said something interesting. I mean, you just highlighted how the CMS regulation going forward is kind of aiding or providing a forcing function towards making it more value-based and more patient-centric. As you kind of think back to your financial services days and how far that industry is, do you think regulation in healthcare has been holding it back, or is it actually promoting or propelling that industry into more patient-centric care right now?
Yeah, just like any regulation, there's a good side to it and a bad side to it. The good stuff that come out of CMS is we all operate on a scoring system called OASIS, where we validate the health of the patient, and that's standardized across the industry, so you get a star rating, 1 to 5. So when you talk about consumerization in the home health industry, the ability for a patient to identify the best provider in the area that has proven outcomes is available to them. The bad side of it is what I spoke of before. Because of that regulation and how you have to provide that care, it really limits your ability to innovate in the course of care that's provided, or the care plan that the patient receives. And that's measured in CMS under what's called LUPA management, which is how many visits are required by the type of episode the patient has. And in cases where you may be able to bring the patient back to health with 2 or 3 visits, you don't qualify for reimbursement unless you visit that patient 5 times. So it's things like that that drive inefficiency. Cost of health care goes up as a result. And these value-based agreements allow us to just focus on getting the patient better, either through enabling technologies like telehealth, remote patient monitoring, you name it. But ultimately, the regulations have a pro and a con to the industry as a result of that.
Yeah, it's interesting. I mean, some of those decisions that need to be taken clinically get taken by the regulation, sounds like.
In some cases,
and that's an impediment, of course.
Yeah.
Can I give you a flip side of what I think is a pro? So a lot of what the CMS mandate did is require all of us to be in a position to then share data, right?
That's
Create platforms that we can do more data sharing. And those platforms aren't cheap. So try to go and do an ROI on a platform like that without having a mandate in place is pretty difficult. So at least for HMSA a couple of years ago, when the mandate came in, and we figured we have to have this interoperability platform. This was millions of dollars that we were investing on top of a new data warehouse that we're building. We combined those initiatives together, and because of the mandate, we're in a much better position now to strategically take advantage of the platform that frankly, it may not have been able to afford to put in originally. So you're right, there's pros and cons, but I think it's pushing us in the right direction.
Yeah, and I would say the interesting thing about this conversation was as we met as a group prior, we all realized we're all working on the same stuff, just in different ways, right, to solve the problem. But 5 years ago, when CMS's Blue Button was approved, if you guys are familiar with that, that's the ability to get access to all of your Medicare and Medicaid claims. The payer side of the equation fought the legislation significantly because it gave providers like us access to data that they typically charge for or prevented access to. So that's the good side of the regulation, is forcing that sharing of data and access of data will help with the outcomes in the long term.
And that's part of what I was talking about. We're friends now, because the government actually did something good with the 21st Century Cures Act.
That's right.
By December, we all have to, be sharing that data. But Rick's right, the platforms are not inexpensive. But it gets you into a position where you can plug and play now when we talk about these I talked about the bio button. Now we can use that virtual care highway to be able to plug that in and have it interact with Epic or any other system we have without having point-to-point interfaces, right, going forward. And that's going to be huge. The cool thing about it is Epic is not the center of the universe anymore. Mm-hmm. Although if Judy heard me say that, I probably shut up my system or something. But there is no electronic health record for virtual care. So you need to have the plug and play. And we're actually going to go back to more of a best of breed approach, which is kind of scary. But with that highway that you can plug into, you can manage the best of breed because you can pick and choose the data that needs to move on that highway and connect it to the systems that it needs to go to. So that part's super exciting. Yeah.
So if you were to kind of think about the biggest challenges we need to overcome, would you say that challenge is technology related? Is it data security, privacy related? Or is it more of a cohesion between the different players in the industry and, of course, the regulation to kind of come together?
Yeah. For the provider side, it's the provider workflow that will be the biggest challenge, not the technology. When you think about it, taking a physician who's used to seeing patients face-to-face, depending on the issue, maybe getting a consult to a specialist, things like that, that's all going to change because it's going to be a virtual journey for the most part. There will be what I call analog journeys where you're actually meeting with somebody, but you're going to try to keep that patient on the digital highway. So the physicians have to be trained to be able to work in that type of environment. And you're going to start seeing more and more medical schools actually changing their curriculum so that physicians will start to learn how to do that in a digital way. There's some out there already looking to revamp their curriculum. But imagine taking a physician that's working directly with a patient, use that, and now putting them on a journey, a digital journey, the way they do their work, the way they bill, the way their office runs. It's completely opposite of what's happening today. So that's the change that's going to need to take place.
So with the rapid proliferation of technology, you talked about AI and the need for training these physicians in med schools. But for all the physicians that are out there already practicing, right, if you were to kind of consider the behavioral change that needs to happen, that the training, the know-how that they require, do you see this as a 5-year process, a 10-year process? Because technology will keep changing every 3 years, and you'll have more and more AI assist, more diagnostic assist that the physicians will have to pivot to.
I mean, it will be ongoing. This is, when you look back at the things that happen in healthcare, if you go back 150 years ago, starting with like anesthesia, right? And how that changed people's lives. And if you look at there's like a top 7 things that happened, the last one being Lipitor, was because it kept a lot of people, hundreds of millions of people alive that would have had issues. This is the 8th one, probably the 8th or 9th one. COVID, we'll look back at COVID as, yes, awful, but it actually accelerated the whole digital aspects of healthcare, the digital front door, everything that we're doing. The outcomes are going to get better. People are going to interact with the technology in a different way. Costs are going to go down. Patient experience is going to go way up. Do you want to recover in your home or in a hospital bed? I mean, there's a big difference there, right? And I think we'll look back 10 years from now, and the acceleration of technologies is going to happen as well, because we're looking for AI tools and ML tools and things like that. Without COVID, we wouldn't be sitting here right now talking about what we're talking about. So, big.
So maybe to add to a couple of comments. In 2017, HMSA got into value-based, what they call it payment transformation. The technology really wasn't quite ready, but they rolled it out, and there were technical issues and technical challenges. It wasn't embedded in the workflows. The technology continues to get better. Then COVID hit, and all of a sudden, nobody's showing up for an appointment. But those providers were still getting paid. So all of a sudden, they liked it. The behavior is starting to change now. The technology is getting better. They started to understand the value of having a value-based plan in place. And so what we want to do is to build off of that. So as the technology continues to improve, as we're starting to understand how do we build into the workflows, everything we heard this morning was about data, right? Data, insights. What we're looking at is how do we get more real-time, bidirectional data, social determinants. The more we can add clinical data on top of the claims data, the more information we have, the better we'll be able to target individuals for what kind of plans that they need. The better we'll be able to do analytics around populations and pop health, and then target the areas that we need most. And so over the next few years, I do believe not only will the technology is going to advance, we're going to have more data that we're going to start to be able to work on. We're going to have more collaboration between the payers. And what you're doing, this whole monitoring, is a whole nother. It's getting real-time information fed in, whether it's on the provider side, payer side, but it's going to be able to provide people information that they didn't have before at a much faster time. The other challenge, though, that I think we're all facing, certainly in Hawaii we have an aging population of physicians. And there's two aspects of that. One is the folks that have been aging have been the most prone to not adopting to the new technologies, right? So, and eventually, they're starting to age out. We don't have enough physicians coming up. We don't have enough nurses available. So all of that, again, is going to drive innovation in technology. And how do we start helping? You won't solve it, but how do we start helping? And I do think things like ML and AI, they will provide more insights that will make it easier for people to get their jobs done. And it should improve the experience that our members and our consumers have.
Yeah, I was going to say the people are probably our biggest challenge. Same clinical workforce turnover is astronomical in this field. Typical in clinical is about 40 to 45%. In non-clinical roles, we're upwards of 55 to 60%. So if we don't have the caregivers to deliver the care, regardless of the technology that's there, the care provided is not going to be at an adequate level. So a lot of the focus that Elara has taken on is pushing employee engagement platforms to bring our frontline workers closer to the mission and vision that our company holds and how we drive that. So our focus is not just on retention, but it's also enabling our clinicians and our non-clinical staff to work with us in different ways. One of the key things is we're looking at leveraging technology like Uber to open up available schedules for people in non-clinical roles that want to work at their day job 9 to 5, but pick up shifts on the weekends or in the evenings. That opens us up to a much broader workforce, but it leverages technology to enable that operation to run more smoothly and allow us to care for more patients in return.
Yeah, one of the retention aspects that we're looking at right now, because you can only give so many raises and you can do bonuses after 1 year or 2 years, but we're looking at paying people daily. So they get money after each shift that they work, which is, it's kind of interesting when you think about it. You're probably going to show up the next day, right, as opposed to waiting 2 weeks for a paycheck. So you're going to see strategies around that for retention. That's pretty interesting.
I wouldn't want to be your payroll provider.
No.
That's the crazy thing, that technologies, daily pay, pay
Yeah.
active, there's a few that are out there. It's earned wage payment, so you complete your shift, you can draw on the pay that you would have received. It actually reduces your payroll overhead. So it's actually kind of an interesting use case. Yeah.
That sounds cool. If you were to kind of turn the wheel around and think about how all of these measures, initiatives, investments are kind of actually impacting the patient, do you have measures or metrics to kind of measure that patient experience? Do objective measures even exist? Now, we can measure the clinical outcomes and the clinical markers of patients' health and kind of do a trending on that. But in terms of patient experience, patient satisfaction, are you doing anything to kind of measure that?
Yeah, we are. One of the things we haven't talked about is the analytic aspect of virtual care. you've got all this information coming in a lot more than 5 years ago because you've got sensor information, that bio button that I mentioned earlier, that streaming data that you're storing. So what we're trying to create is a patient persona where we understand you and you're different than somebody else, what your likes and dislikes are, right? So if you think about how Amazon works, really creating that kind of Amazon experience. So when you come in through the digital front door, we know who you are, what your likes are, how you want to be contacted, and start to push things to you that maybe you didn't even know existed, but it's based on that patient persona. It's kind of like when you go on Amazon, they're like, oh, if you like this, you're going to like this, right? And it's creating that type of experience. And the only way you can do that is through that data collection and through AL, ML, various tools it's not SQL-based mapping databases anymore. I mean, this stuff is an ecosystem, living, breathing, changing, every nanosecond as you're collecting that information on the various patients, and that's how you'll know as to what's working for that individual and what's not. So you get away from the cohorts of everybody that's 25 years old wants this. Well, no. We want to know that individual 25-year-old and what they like and don't like. So, same thing.
Yeah, so I'll take that for 2 seconds if I can too. So in my industry, we've got the, again, pleasure of regulation. So CMS dictates OASIS star rating, right? So that kind of gives us that check and balance. But Elara, we're starting to approach this differently, and we've embedded NPS scoring in our patient experience, so treating them just as if they were a customer. They receive care from us, sometimes dictated by Medicare or Medicaid, but ultimately the patient has a choice. So we're very interested in mining not only the analytics that come back from that, but also starting to leverage sediment analysis and clinical note mining, where we're identifying some of the social determinants to health that don't get entered into the patient record, pulling those out, identifying what I call cross-sell and upsell, bad word to come from the financial industry. In healthcare, that sounds like solicitation for CMS, they don't like it, but ultimately it's identifying where we can provide care to a patient that may not be aware that they're eligible for those benefits. And that is a big move forward for us to not only help improve the profitability of our organization, but ultimately provide the care to patients under CMS who have paid into the program and aren't aware of the benefits that they can get. So that's how we're tackling it.
I think that also demonstrates why it's so important that we're all working together and sharing that information.
Yeah.
Extending the theme of working together, all the stuff you're talking about, from an organization's point of view, it needs IT, clinicians, all the different administrative processes to kind of come together to make this real. How are you seeing that pan out? I mean, what's the governance around this? Because who's driving this within your organizations?
Yeah.
Is it being driven by the CIO, which is yourselves, or by the clinicians?
Well, the interesting thing now is, when you look at IT, typically in the past, and even in the present, you always wait for the business strategy, right? And then the IT strategy enables the business strategy. That's flipping now. The IT strategy is leading now. When you start putting in virtual care platforms, that's your strategy. So the business is going to come in behind that. Very different than what I was always taught. I've been a CIO for 26 years. You don't move until the business strategy is set, the 5-year strategic plan, and then the IT looks at it and enables it with, oh, we need this product, we need an electronic health record, we need this. Now it's the other way around. We're going on a virtual care journey, and the organization, you better get moving. You got to change the way physicians practice. You got to change the workflows, all that kind of stuff, or you're going to be left behind because we're moving forward. Very different than what has been done in the past.
Do you run into adoption issues with that?
Oh, big time. But that's where you need leadership on, like physician leadership on the operation side where they get it, and CEO leadership and board leadership to give you that opportunity to lead versus, coming in behind.
So we took a little bit of a twist to that. We do have 3-year company goals and objectives that are clearly understood, and there's only a few of them, and we all know what they are, and we all communicate, and the executive team is accountable and stands behind that. So there is a good business strategy. What changed in IT was not just to have an IT strategy, but to have a digital strategy. So very purposeful in putting a 3-year digital IT, technology, and digital strategy together, very much in alignment now with where the business is going. Now, the other thing we've done, I just want to step just for a minute on the whole consumerism, because it is changing. And even within the Blues, we're really trying to understand what is this. Is there another fire? So we are looking and really trying to understand what is consumerism going to mean to us. So we've done journey maps and we understand how that works, but we're looking at other industries. So we're looking at retail and we're looking at banking, but because there's so many other industries that are farther ahead than we are, we do want to step back a little and understand, so what is that going to mean for us? And then what we'll do is start lining up our investments against where we believe we need to be spending. And so working with the marketing folks and the communication folks, getting our providers in provider support groups, our member groups, we're looking at it, but we're trying to look at it through a different lens and really understand, again, what is this going to mean in the next 3 to 5 years, and are we making the right investments? We believe we're putting in the right platforms and the right infrastructure. Now we need to figure out how are we going to leverage that most appropriately.
Thank you, Rick. So Kyle, based on my discussions with you both here and offline, sounds like it's very IT-driven at Elara as well.
We're in a unique situation, coming out of the financial services industry into healthcare. Initially, at a very large DME, I used to quote and say, "Guy, I feel like I took a decade step back in my career." Then moving into home health, I think I took another 2-decade step back in my career before I was even in IT. We're still operating in that way. So our technology strategy is very closely aligned to the clinical and clinicianal needs of our organization. Our nurses are begging for improvement. The time they spend entering clinical documentation, notes, and so forth is time they don't spend with the patient. And our real impact in this industry and technology right now is being able to minimize the time that the clinicians have in performing the administrative duties and really starting to focus more on the outcomes for the patient. And we're being incented by the payers to do that now as we move to these capitated and risk-based agreements. Right? The more we can get the patient healthier faster and ensure they are not readmitted to the hospital, the more the company profits. So we're now finally starting to see that incentive drive the right direction for really the goal of improving the patient experience. So it's very much technology driven right now.
So we do talk a lot about patient experience, but at the end of the day, it's us, right? So what do we want to be able to do on our phones? What are our digital front doors? I know personally I want to have my insurance card, so I just go to the doctor and I can show it. Like I put it in my wallet, just walk in, be able to check in. When I check in, I want to have all the information about me so I don't have to enter all those forms in. And then I want to be able to share that. And then when I'm ready and I do get sick and I want to go to the doctors, I want to be able to go in and I want to go online. I want to check to see, well, how much is it going to cost me? I want to do a little comparison to make sure I'm getting the right price. So, eventually, and this is where I think we, consumers, will end up driving a lot of the changes that were going to be needed because we're getting used to it. We know when we call an Uber, we can track where it's at. When we get on an airplane, we don't have to give them a piece of paper anymore. If we want to order something from Amazon, it's going to be delivered the next day. Those are the behaviors and the characteristics that we are going to start demanding of our payers and our providers. And this is why I think it's really important that we're all working together, because we can't independently solve that problem. And then again, back to if regulations can start helping drive some of that to make sure that we're all marching down the same path, I think that's a good thing. But in the end, it's how well are we going to collaborate, how are we going to work together to make sure we're solving a lot of those problems.
And as long as the payment structure,
we have to work on those too,
right? Then healthcare.
And you share your data.
It's all about the money, right?
It
it's all
is.
about the money, and where the money comes from. And the only way to get away
yeah.
from fee-for-service is exactly what Rick and Kyle are talking about, is that moving into that value-based care where, a high patient experience along with high quality and low costs, you win from a financial standpoint. Once we get to that point,
Well, and we
then
have to
this
work
will
together
change.
to figure out, what do you need, what do I need, what do we
Exactly.
need together that's going to make it better.
Let's go get a margarita.
Let's go.
All right.
Okay, we are coming to the close of time. Do we have the permission to take any audience questions, or are we done?
1 second.
You got 0 seconds. I guess we're done.
0 seconds. So I only have time to thank the panelists. Thank you so much.
Yeah, round of
for-
applause, please, to our panelists. Thank you, Nishant. Thank you, everyone. I appreciate it.